Hello, welcome. My name is Lyle Murphy, and today we're here to talk about Lamictal withdrawal, which I represent Alternative to Meds, and I just noticed today that we are #1 in the world for the term Lamictal withdrawal. So obviously, we have some authority on it now. The first question I want to address is, what is Lamictal used for? Well, originally it was used as an anti-seizure because they believed that it blocked folate, and that by blocking folate, it would reduce incidences of epilepsy. Well, that wasn't actually the mechanism for it. It still is classified as an anti-seizure drug, but it has nothing to do with the restriction of folate. Most often, it's prescribed as a treatment for bipolar, and it's classified as a mood stabilizer. Sometimes they give it to people when they don't want to give an antipsychotic, which could be considered more debilitating in this ways of side effects than Lamictal, and that is dependent from person to person. But Lamictal is generally a slightly less impactful medication than, let's say, an atypical antipsychotic. All right, what does Lamictal do chemically? Well, it's got kind of this wide range of things that it does. So it's one of these multifaceted Frankenchemicals, I guess you could call it. But one of the things that it's believed to do is to inhibit glutamate. Glutamate is the most stimulating neurotransmitter of the central nervous system, which means when you have glutamate, you can be very anxious and excited. And they have even attributed to excess glutamate as being a mechanism for psychosis. So by inhibiting glutamate, theoretically, you lessen someone's threshold for going into psychosis and mania, or anxiety even. Also, it is believed to enhance the efficacy of GABA. GABA is the counterweight, I guess you could say, for glutamate. GABA is the most inhibitory neurotransmitter of the central nervous system. So it's bringing down the excitement and it's increasing the ability to have the softening of GABA. But also, it's believed to inhibit aspartate. Now, aspartate is an excitatory neurochemical that is not quite to the level of glutamate, but it is excitatory in the nervous system. And by inhibiting aspartate, it's another way to just sort of calm down the nervous system. Number 3 question, what do I need to know about Lamictal withdrawal? Well, Lamictal withdrawal can be, not always, but certain people can have some pretty horrific withdrawals from this medication. We treat it a lot like an antipsychotic withdrawal because it takes a very pristine sort of withdrawal technique in order to get someone off of this medication without them feeling like their world's going to be completely undone. One of the one of the tricks you might want to know about Lamictal is that because of its effect on aspartate, aspartic acid and aspartame, like basically the breakdown of aspartame, which is the artificial sweetener, can stimulate the nervous system in the same way as aspartic acid because of its metabolism. So if someone's drinking diet sodas and trying to come off this medication, it's probably not the best idea. You want to limit not only the aspartame, but you also want to eliminate glutamate-containing foods from your diet. That would be MSG. Anything that has MSG, monosodium glutamate, is increasing glutamate in the nervous system. And when you're coming off a drug that's been restricting glutamate and it's restricting aspartic acid, you definitely do not want to be shoveling aspartame or MSG into that same organism because that can be enough to make this withdrawal entirely catastrophic. Other things that you can do to help the Lamictal withdrawal, question number 4, what can I use to help Lamictal withdrawal? Well, the glutamate acts on a receptor called the NMDA receptor. And so anything that's going to help kind of buffer that's going to inhibit that receptivity, one of the things that's known to be an NMDA inhibitor that's quite available is CBD. CBD is an NMDA inhibitor and could help facilitate some softening from a Lamictal withdrawal. If it's really extreme, if it's more so than what could be helped nutraceutically, then you might want to consider using gabapentin. Gabapentin will enhance GABA so that you're coming off of the other components of the drug while at the same time not having to deal with a GABA plunge. So it could help with a bridge transition there. To get exact dosing, you would probably have to ask your prescriber. I don't want to be bridging over into what might look like giving medical advice. But the typical withdrawal range for gabapentin for somebody withdrawing from Lamictal could be anywhere from 600 to 1,200, 1,500, somewhere in that range. And it's not meant to be long-term. It's meant to be a bridge medication to help them get over the hump of the Lamictal ups and downs. Like with any withdrawal, also, you want to set aside the time to do this. While you may be stable and functioning, or even maybe you're not functioning completely well, but you have a level of groove in your life that has been manageable with this particular drug, while you're coming off of it for a period of time, it may be extraordinarily different. And you want to make sure you have the time set aside to do this, that you be patient with yourself, because oftentimes when we're going through something, and it's right here, we kind of manufacture that it's also the tapestry of our life. This is just a medication withdrawal that you're going through, and the things that come up will likely transition. Doing a medication withdrawal like this slowly, I generally wouldn't recommend more than a 10% withdrawal for someone who is truly sensitive. Other people can get away with going faster, but at least try starting out slow. You know, there's no really harm done in going about something more slowly and easing your way into it. If you did fine with a 10% cut, maybe you can do a 20% cut next time. I don't know. It's really dependent on you. But generally not going too fast is the way to go with this. Because if you go too fast and you hurt yourself, or you get into a place where you're panicking, it would have been much easier to just slow it down. And it's kind of like driving a truck down a mountain. You know, you can drive the truck a little bit too slow and still get down the mountain. If you drive it too fast, you drove it off the mountain. A time frame for this medication will definitely vary from person to person. Typically for the antipsychotic class, we recommend 1 month for every 1 year that you've been on the medication as far as tapering. And that's a rough guide. Of course, if you've been on it for a year, then you might want to take more than, a month to do it. You might want to take, 2 months. But if you've been on it for 10 years, you may be looking at 10 months to get off this medication. So again, each person is very unique. Some people have good, a better fortitude or better ego strength than other people. It really is dependent on you. We have withdrawn a lot of people off of Lamictal, have had a lot of success with it, obviously. And, we're here to support those residentially in a residential center, and also help support those out there in the community by finding resources that they can use at home. So feel free to call us. If this isn't a fit for you, then we'll help to find something that is a fit for you to the best of our ability. All right. Thank you much, and have a great day or evening.